Hi everybody, my name is Allie Maloney and I will be introducing the 7-day healthy meal policy proposal based out of the Worcester County Public School System in Massachusetts. This nutrition-focused policy is being implemented to fill the hunger gaps in the Worcester County Public School Wellness Policy. The Summer Eats program that has already been implemented as a nutritional program that is federally funded to provide free meals to children under the age of 18 when school is not in session. There are multiple checkpoints all around Worcester where meals are offered at pickup destinations. This particular program is funded by the United States Department of Agriculture, supported by the Child Nutrition Outreach Program, and administered by the Massachusetts Department of Elementary and Secondary Education. In the year of 2020, due to COVID-19, this program was extended by the United States Department of Agriculture through the 31st of December, offering free meals at multiple pickup destinations. The gaps that the new policy proposal will fill are the days off, long weekends, and other breaks that are not otherwise covered by the Summer Eats program. The 7-day healthy meal policy was constructed to provide students with both breakfast and lunch when school is not in session throughout the entire year, excluding the U.S. holidays, and this will ensure that all students can always have access to healthy meals in the Worcester Public School District. The hunger gaps that are not usually accounted for in the meal programs offered in the Worcester Public School System include weekends, long weekends, spring break, and typically winter break, with the exception of the extension granted by the United States Department of Agriculture. Under the 7-day healthy meal policy, both breakfast and lunch will be packaged into to-go meals for the pickup zones located all around the city of Worcester. The food served in this policy will fall under the same food regulations as when school is in session. This program will not distribute competitive foods and will comply with the nutrition standards put forth by the Department of Public Health. The Worcester Public School District aims to teach, encourage, and support its students to develop healthy eating habits, thus the food marketing will be school-based advertising that is consistent with the nutrition, education, and health policy. All meals would currently be free according to the USDA, but if these regulations were not in place, the policy would follow the free or reduced price or the full price school meal regulations that were authorized when school was in session. It is important to target and value the nutrition of high school students because the input and authority of both school and guardian declines during the years of adolescence. At this life cycle point, students will have the freedom to make their own decisions, including their own choices and amount of food consumption. High school is important in terms of academic performance because the performance contributes to their future. Good nutrition at this age leads to positive health effects, better school performance, and students are more prepared when they do enter school. This is a crucial age for hormonal, physical, and mental growth of high school students, where proper nutrition is required for optimal results. Because high school students are the oldest age group in the school system, they are more likely to retain the information that they learn, and they are more likely to be practicing these healthy eating habits that will later translate into adulthood and lead to healthier outcomes. The purpose of the implementation of the nutritional policy that is in place is because there is a high percentage of high school students in lower income areas that are not given the opportunity to have access to healthy foods that meet the USDA requirements outside of the school meal programs already provided. Just last year in 2019, the childhood overweight and obesity rates were higher in Worcester, which was 41.3% compared to the overall prevalence in the state of Massachusetts, which was only 31.3%. There are many positive effects associated with healthy eating habits prior to entering adulthood, such as improving mood, academic performance, maintaining a healthy weight, and preventing mental health conditions. The The purpose of this policy proposal is to provide year-round healthy food access to students in the Worcester County school system because there is no current policy that does provide that. There is a high need for healthy nutrition implementation in the school system because it can affect students in almost every aspect of life. For example, low nutrient diets have a negative impact on school by decreasing focus and concentration, making it harder to retain information, decreasing overall academic achievement, increasing the amount of sick days. There is a high rate of absenteeism, and overall increased rates of dropout. Poor nutrition also has negative effects on mental health by increasing the risks of disorders and affecting overall mood in a negative way. The consumption of unhealthy food can have a negative effect on future diseases such as increased risk of obesity, decreased immune system strength, and increased rates of heart disease and diabetes and higher rates of mortality. Low nutrient diets also interfere with optimal growth and development during this crucial maturation time for high school students. High nutrient diets in schools promote optimal brain performance, which then improves memory information, retention, and overall concentration. It also increases academic achievement with higher rates of school attendance and increases in graduation rates. All of these factors play a large role in promoting a more successful future for the students. Mental health can be affected by good nutrition by decreasing the promotion of mental health disorders and improving overall mood. Healthy food can also help maintain a healthy body weight, build a stronger immune system, decrease the risks of heart disease and diabetes, as well as increase lifespan. This policy will have strong community support and involvement as well as PTA physical and financial involvement to help distribute the meals every morning and help fund. There will also be support by the Child Nutrition Outreach Program, very much like the Summer Eats program. It will be administered by the Massachusetts Department of Elementary and Secondary Education and also funded by the United States Department of Agriculture. Much like the summer meal program, schools will be reimbursed by the USDA. Additional staff hours must be accounted for when cafeteria employees will be preparing, packaging, and potentially distributing meals depending on PTA involvement. We will be working hard to encourage participation of high school students due to the statistical decline of high school student involvement in school lunch and breakfast programs. In order to encourage higher participation rates, the students will be given a choice of what they would like to eat for the week. Through the high school website, an online meal submission will be offered where students are able to provide meal suggestions and select what they would like to eat for breakfast or lunch meals during that week. The outdoor pickup zones also serve as a safe social distance area for students and community to socialize and communicate. This will ensure that even under COVID safety protocols, students will still have the opportunity to mingle with peers. These pickup areas will also be spread all over Worcester, making it easily accessible for every student. The anticipated outcomes after implementing this policy proposal will be to increase the access of healthy meals of all high school students around the city of Worcester, and more healthy meals will be provided. By consuming both breakfast and lunch, which is 2 out of the 3 meals out of the day through the Worcester County school system, all students will be given an equal opportunity to meet all nutrient requirements and reduce academic and health complications. It is anticipated that after the implementation of this policy, the rates of absences, health complications, and dropout rates will decline. We should see an increase of an academic performance, overall mood and mental stability, and encouraging healthy eating in the future. Thank you very much for your time, and I hope you enjoyed this presentation of the 7-day meal policy proposal.